I am a preschool teacher. I was teaching my 3 and 4-year-olds at work, and I can remember texting my husband at 8 o'clock in the morning saying, I feel a little dizzy.
Mary Cashmore was just 5 weeks into her pregnancy when she experienced a serious stroke.
I was scared to death because I thought something was wrong with the baby. I would have never even thought in the slightest that I was having a stroke.
Mary's family knew she needed immediate medical attention. They took her to Cox South.
Mary was non-responsive. I could tell that we were close. She almost died.
She had a brainstem stroke. This is the worst possible kind of stroke where people are locked in and can only control eye movements and require life support forever.
I've known Mary for years, and it was really tough to get that call.
The clot-busting drug TPA was Mary's best hope for recovery.
Medications that thin the blood can be very risky for an unborn child.
I was more scared with Mary than I was with almost any other stroke patient that I've seen, and I've seen a lot.
You see your wife sitting there or laying there in the bed with her whole left side drawn, it's pretty scary.
I didn't know what was going to happen to the baby, and that wasn't my big concern at the moment, because if she's not here, there's no baby.
The clot-busting drug worked. Mary had a full recovery.
It was the biggest wave of relief that you can imagine.
I got it within 45 minutes of being there, and Dr. Lynch says that is what saved my life. She goes, you have a 3-hour period, and she goes, she just kept telling me, she told me I was an anomaly and a miracle all in one because, I woke up, I didn't have to have any kind of physical therapy or occupational therapy or anything, so.
There are a lot of things that can cause people to have strokes. So if you go through an entire evaluation looking for those standard causes and you don't find them, that's a term called cryptogenic stroke. Fancy term, but basically it means you've got a stroke that's not found on the basis of a normal workup for things that we know are associated with the cause of stroke.
Mary has a what they call a PFO, which is a small hole in the septum of the heart in the atrium. Most likely because of her pregnancy, she formed a clot. That hole allowed that clot to go through, and it went straight up into her veins in the brainstem.
Mary was seen very frequently by myself and our high-risk OB doctors.
So Mary was at risk for having another stroke during vaginal delivery because of the particular hemodynamics involved. We felt it was very important that we close the defect to remove that risk. We had to do that while she was pregnant.
It was a long, long road after. I've been to doctors every week, and I'm just so in awe of everything,
Stroke is such a devastating insult that to see someone come in essentially unconscious, unresponsive, unable to move the left side, have an appropriate intervention be performed, and come back completely to normal is one of the most gratifying situations you can have in medicine. And then to be able to do something that is not even available in many hospitals across the country, especially with the experience that we've had to try to prevent that from reoccurring, that's an outstanding situation to be in, and it's very rewarding and bespeaks the talent and dedication to the neurology team as well as the cardiac team.
That summer, a happy, healthy Nora was born.
Who I say is my miracle child because she came through it. It was the best day of my life.